name is Maya Har. For my final project for psychology, I chose the topic of gender dysphoria. One of the main reasons why I chose this topic is because I have a son who's transitioning from female to male. And as close as I am to the actual diagnosis, the person with gender dysphoria, I have not done any research. So I appreciate the opportunity for me to actually do that so I can be a better support system for my son and a better advocate for those folks out there. So gender dysphoria is a diagnosis that is given when a person has a deep feeling that their assigned gender, so assigned meaning given at birth, their assigned gender is not their true identified gender. They don't identify with that gender. They identify with the opposite gender. And the American Psychological Association says that these feelings have to occur for longer than 6 months in your adolescent and teens, and then also have other symptoms that kind of go along with it. So some of those other symptoms are things like a real hatred or sometimes even a disgust for your own genitalia, other associated diagnoses that a person has, like depression or anxiety, and then sometimes even self-harm that the patient has been through or going through, and even suicide attempts. Oftentimes there's sleep problems, there's school problems, there's attendance problems, and so some of those things can indicate a person really feeling uncomfortable in their own skin and perhaps identifying as another gender. And so where should you start to get the diagnosis? You should really start with your medical provider, although they may not be the best place to continue care. Your medical provider may refer you to psychotherapy, may refer you to a gender clinic where they have specialized resources for those folks. I think in addition to being seen at a gender clinic, you should always, or the person should always be doing psychotherapy or seeing a therapist in some way, shape, or form, and on a regular basis. It's not something that a person should see, maybe once or twice, but really ongoing for a long period of time, because it's not an easy thing to deal with. If a person decides that they want to transitioning is not easy, and it is full of daily struggles. And so having a good support system in your family, but also along with your therapist, is going to help better cope with some of those daily challenges. And that's how it's diagnosed. Treatment methods, medically. Let me be also really clear that there's no pill that says, take this pill and you're not going to feel like you identify this way anymore. You're going to identify as your assigned gender. That's not accurate. That doesn't happen. What the treatment methods focus on are helping the person either cope with their feelings or, coping with their feelings, but then also transitioning if they choose to. Not everyone decides to transition. And so medical interventions with that are hormone therapy and surgical options to remove genitalia or reconstruct and rebuild genitalia of the identified gender. And then part of the media, I think, plays a big role in how much we're seeing the diagnoses of gender dysphoria recently. I think the show, if you've ever seen it before, I Am Jazz, that show, I sometimes wonder, it's this story about this transitioning female, and if it weren't on the air, would there be so many people transitioning, or people be coming forward to say, I identify this way and I want to transition too? I think there's two roles to that. You know, maybe people are getting more brave because there are these other brave folks out there that are willing to share their story and put themselves out there, and they too, you know, have the courage now to go ahead and do that. But maybe some of that stuff is also just not really accurate and is putting ideas into people's heads. So me as a medical professional, I always wanted some solid proof, and there doesn't seem to be any, except for with my research that I did. The Cleveland Clinic is actually doing research with brain function and gender dysphoric folks. And what we know about brains is that male and female brains, they function differently and they look differently. And what they're finding is that gender dysphoric brains actually function and look the same as their identified gender. And that's some very interesting type of stuff. And so I think there's an aspect of nature, there's an aspect of nurture, and psychology as a whole can really be beneficial in kind of helping to figure that stuff out. And so I'm looking forward to seeing some of those results. And maybe in the future, there will be more widespread knowledge about this, you know, brain activity and some real concrete things that, you know, now a person can say, you know, there's real proof that this exists. There's real proof that I am the way that I am. You know, and just solidifying that it's not all in your head and it's not something that's made up. And so, thank you very much. I appreciate your teachings, and I've enjoyed psychology, so thank you.